So then the UK is rapidly becoming one of the worst affected in Europe by coronavirus. There have been more than 500 deaths in 24 hours for the first time. And this spike comes as a 4,000-bed hospital is due to open in East London to treat COVID-19 patients. The temporary hospital was set up in 2 weeks. The government is under growing pressure to increase testing, especially for its National Health Service staff. Nearly 30,000 people are infected with the virus. Let's go straight away to our correspondent, Rory Challenge, who's live for us in London. He's outside the convention centre that's being turned into a hospital right there. Rory, first of all, the numbers now reaching alarming proportions in the UK.
Yeah, over the last couple of days, there has been a very steep curve upwards in the daily death toll. So the latest figures from the NHS are that 563 people died inside Britain's hospitals, and that's important because there will be a number of people who've died outside of Britain's hospitals in care homes or their own homes, etc. Perhaps by 20% more. Those figures will creep in over the next week or so. But going back to yesterday, the figure was 381. The day before that was 180. You can see how fast the death toll is increasing in the UK at the moment. And the advice or the warnings that the government is giving out is that we're nowhere near the peak of this yet. So we've still got another couple of weeks. If you look at the figures, if you look at the stats that are being published, the UK is plotting pretty much the same trajectory that Italy was doing about 2 weeks ago or so. So the UK is seemingly on course for the same kind of effect that coronavirus has had on the country as Italy. And that's why this is needed, because this facility here, with its 4,000 beds eventually, will be coping with the onslaught that COVID-19 is having on the established hospitals of the United Kingdom. So this one here in London is the first, but there are going to be others. There's one being constructed in Manchester, another one in Birmingham, and perhaps more elsewhere in the country to try and mitigate the effects that the coronavirus is having on a very overstretched National Health Service.
Right, and as fatalities rise, Rory, people will point, no doubt, at the WHO advice to test as much as you can, and the UK seems to have been well behind the curve on that.
Yeah, and it has been for some time. This is something that the government is playing catch-up on. It's not just testing, it's also the availability of ventilators and personal protective gear for health workers on the front line. All of these things are very hot issues at the moment. But drilling down into the testing issue, yes, the WHO is saying test, test, test. But when you look at the number of tests actually being conducted in the UK at the moment, maybe 8,000 a day. Compare that to Germany, which is conducting many times that number of tests. So why is the UK lagging so far behind? Well, the government says we have not had access, and this is a global problem, they say, to the right chemicals for testing. We haven't had access to the right amount of laboratory capacity, and we don't have the right testing kits. That is an argument that carries some truth, certainly. But you've had chemical companies over the last day or so and academic institutions saying, hold on a second, we've been offering you our help for some time now and we haven't had that offer taken up. So it does seem like there is a problem here with the UK trying to do what it says it's doing and ramping up testing. At the moment, the testing is being done in hospitals and now in mobile testing centres elsewhere in the country. Predominantly, the testing has been done on patients, but what they're trying to do is give the frontline medical staff the testing that they have long been asking for.
All right, that's a picture in the UK where there have been more than 500 deaths in 24 hours for the first time. Rory, thanks very much indeed. Well, while the focus is on treating thousands of sick people, millions more in the United Kingdom are adapting to a different way of life. Earlier, my colleague, Sahel Rahman, spoke to a Chester couple, Stephen and Nicola Downey, about how the pandemic is affecting their family.
At the minute, I'm furloughed from work, so we're just at home with Flo, who's currently watching telly, hopefully. So yeah, it's tricky, but it's definitely the right thing to be doing.
So obviously you've lost your job at the moment. Nicola, obviously as a school teacher, the rules are different for you because you're a key worker.
I work at a primary school and I teach 3 different year groups. I'm not at work at the moment. On Friday, I will be going to another primary school to help out there. And it's been really tricky planning lessons for 3 different year groups whilst having Florence, who's 3.5, at home and trying to keep her entertained and educate her as well.
I'm sure it is difficult as young parents. Are you confident that you have, you might say, the protective equipment you need when you're going into schools? What has been offered to you?
It's continually changing, so there's more things in place now, so such as having bags to put our clothes in once we finish work, again, distancing ourselves from the children. Everything's labelled for individual children who are in. Obviously, numbers are reduced, but there's still, I know when I go in, there'll be 18 children in and 6 members of staff, so that's still quite a large gathering of individuals there.
At the end of the day, you both have professional lives. Stephen, obviously, your family's in Chester as well, I presume. How difficult has it been keeping in touch with them when you actually can't see them physically?
Yeah, it's tough. I mean, we're quite a close-knit family, so we see each other daily. So it's quite tough. I know my mum and dad are not leaving the house at all. So I get to see them through the window, dropping off shopping and stuff for them, which is nice. But it's just very bizarre.
It's really hard for Florence not to see her grandparents and her cousins when we see them at least twice a week, 3 times a week, and it's hard for her to understand why we're not going to Granny's now, and that's really tricky to explain to her.